Huw Irranca-Davies.
Diolch, Llywydd. First Minister, 2 weeks ago, we were pleased to host a Facebook Live event in the Bridgend and Ogmore area under the title of Mental Health, It's Good to Talk. And it was attended, I'm delighted to say, by the Minister with responsibility for mental health, but also by Megan from the Bridgend Youth Council, Mental Health Matters, local men's sheds, and many other organisations and individuals with lived experience of mental health challenges as well. Amongst the many issues raised, 2 themes were prominent. The first was the need for continuing to ramp up overall investment in mental health support and services, from the upstream investment, which you've talked about, First Minister, through to therapies and through to the acute services. And the second was the need for investment in perinatal mental health of both parents, something raised not least by Ogmore Vale campaigner Mark Williams. And I thank the Minister, by the way, for inviting Mark along to a subsequent meeting with others within days to discuss this. So First Minister, can I ask you, what commitment can you give to continuing to boost the investment in mental health support and services across the piste and to perinatal mental health of both parents, and also to help in remove the stigma over mental health issues, letting people know it really is good to talk about mental health?
Well, thank Huw Irranca-Davies for those further questions. In terms of onward investment into mental health, he will know that a draft budget that was laid before the Senate some weeks ago, and in the final budget that will be published later today, we will invest a further £42 million in mental health, the single largest sum of money in our health budget is devoted to mental health, and this will be a significant further investment in the next financial year in sustaining those services, which, as Dr. Lloyd said, will be so necessary in the months ahead. As to perinatal services, I'm pleased to be able to confirm to members that we remain on track to invite the first patients into the new residential perinatal mental health service that is being created at Tonna Hospital, not very far from the member's own constituency. That was a commitment given by my colleague Vaughan Gethin, that we would create a new inpatient facility in perinatal mental health, and that will be achieved before the elections, despite the very considerable challenges that coronavirus has posed to the builders, who are working very hard to make sure that everything can be completed at Tonna Hospital in time for those first patients to be welcomed. And finally, to congratulate the member on the event that he organised. Removing stigma in the field of mental health is a constant effort, isn't it? It's not a battle that we are going to win just by a single event or a single campaign. It remains a real challenge for us all, and I know members across the chamber have played their part in this, to make sure that we go on explaining to people that talking about mental health, being open about experiences, getting the help that can then follow from it, that is the way in which we erode the continuing stigma which, unfortunately, those who suffer from mental ill health continue to report to us.